Hello everybody, my name is Evelina Kozok and I'm working as a practice support officer in Central and Eastern Sydney PHN. Welcome everybody to our quick training about a spill kit. Central and Eastern Sydney PHN acknowledges Aboriginal and Torres Strait Islander peoples of this nation. We acknowledge the traditional custodians and sovereign people of the land across which we work. We recognize their continuing connection to land, water and community and pay respect to elders past, present and emerging. I also welcome all Aboriginal colleagues who are joining us today. The most important thing about cleaning the spill is your policy and procedure because it will be different for every practice. The person who will be cleaning the spill, she needs to know what to do immediately after the spill, where is the spill kit located, who to report it after the spill, and the most important thing for me at least is who is responsible for cleaning, and it will be different in every practice. In some practice it will be a nurse only, so the receptionist will call the nurse. In some practices it will be the receptionist responsible for cleaning, and in some practices it will be even a doctor. So first check in your policies and procedures who is responsible for cleaning the spill. The person who is responsible for cleaning the spill has to be trained and has to have her immunization up to date, or at least offered by the practice immunization relevant to her role. All the information about cleaning the spill, like also other information about infection prevention and control, you will find in the new 2023 guidelines. Here is a link on this slide to the new control guidelines, infection control guidelines, and please don't print them, just keep the link to them because they're constantly changing without notice and it's good to have something updated, not printed. And RACG spills cleaning protocols, I also include link to them because they may be useful for your practice. Let's spill the beans. So can you name 3 types of the spills? It's feces, urine, saliva, vomitus, not sweat. How soon they need to be clean? As soon as possible. Why? Because we always treat them as potentially infectious. This little picture on the right side is the sweet spill. It's chocolate, nothing nasty. We don't have spills like this in medical practice. We have a different kind of. Every practice should have at least one spill kit. The spill kit can be bought commercially. It comes in a little packet like this and will have everything you need. You use it once and then you need to buy a second one because most of the things are not reusable. If you would like to create your own spill kit, have a small bucket to just contain all the equipment. You need a pair of heavy-duty gloves and just the disposable gloves as well. The pair of glasses, goggles or face shields, we have plenty of them after COVID. We need to have the waterproof apron, which is disposable, one-time use, pair of forceps, a roll of paper towels, 2 pieces of firm cardboard or plastic for scooping the vomit and absorbent into the bag. You can use also the small dustbin, but I would prefer the cardboard, which you can just discharge and you don't worry about it. 2 plastic yellow hazard bags, body fluid absorbent, and again if you're creating your own spill kit you can use kitty litter or the other granules, detergent and the hazard sign for quarantine. Nurses will have this poster in their minds, but we need to remember that not everybody knows, especially the girls in the reception, they may not know how to properly put their personal protective equipment. It would be good if the nurse could demonstrate it for the receptionist girls if they are expected to clean the spill. But here this poster is kind of like self-explanatory and you can have it stuck next to the spill kit. So you clean your hands, you put first your gown, then you put your mask, then you put your goggles, at the end you put your gloves. There are different kinds of spills which can happen in your practice. Think about your receptionist, corridors or doctor rooms. There is a hard surface and soft surface. So a flooring or the carpet, and how your chairs looks like. Are they material or are they plastic and easy to wipe? On the hard surface, on your flooring or the plastic chair, the first we will use absorbent agent. It will be a different absorbent agent for different spills. So if it's a vomit, we will use kitty litter. It's also perfect to take immediately the smell out of the area. But if it's a urine or blood, your absorbent agent would be just your paper towels. Then we scoop it or wipe it, put it into the yellow bag. We clean everything with the detergent and water or detergent wipes. Then we allow the surface to dry. Then we use disinfectant if required. We dispose everything to the yellow bag and we clean our hands. It's very similar with the soft surface. The difference is that we don't wipe, we damp pat. So first again, we will put absorbing agent and then scoop it. And here you can use this granules also for blood or urine because we want to just suck it out from the material. Then we damp pat the area. Then we dispose everything to the yellow bag. Then we damp pat again, this time with detergent and water or the carpet cleaning detergent. We need to allow this place to dry properly. That's why we need our quarantine sign. And, if it's a chair and if your practice is in the house, just put the chair outside to dry on the sun. If it's inside, we can't do it, but allow it to dry. Then we dispose our PPE and everything, and again we perform cleaning of our hands. There is a separate training for cleaning hands, which you can find later as a link as well. There are different spills. There are very small ones, small up to 10 centimeters and large, bigger than 10 centimeters. So again, it depends what it is. But if it's like little spotting, we can just use our gloves and just wipe it with the detergent towel or wipe. That's fine. We need to clean it immediately again. Still, I would put an incident form at the end. Still, of course, perform your hand hygiene. Be careful so you don't have any skin contact. But you don't need to use the whole personal equipment, protective equipment. Important thing is to check if there are not glass pieces in there because sometimes the vial from blood can be broken. So then try to pick up the glass with the forceps and use the protective utility gloves in that case. Small spills up to 10 centimeters. It's a bit repetitive what we already talked, but I think if we repeat it many times, it will stick to our heads. So first thing, select protective equipment, and we're using the whole thing. In here, wipe the spill immediately with absorbent material. Place contaminated absorbent material into the plastic bag. Clean the area with detergent. Wipe the area with disinfectant. Ensure the surface remain wet with the disinfectant for a moment. Then allow it to dry. Then perform hand hygiene. With the big spill, it's basically the same thing, with the difference that you just need to remember to cover the whole spill area, and you will change your gloves and between scooping everything and putting it into yellow bin, you take out your soiled gloves, you clean your hands, you put a fresh gloves on, and then you disinfect. Always at the end, you perform your hand hygiene. How to take off your personal equipment. I will also suggest here to ask the nurse to show you how to take the gloves properly, or if in here is the link to the video which shows how to properly take gloves, soiled gloves, so there will be not contact with the skin. But the gloves coming off first, then you disinfect, wash your hands, then you take out your goggles, your apron. The last thing which is coming out is your mask. It's all going to the yellow bin, yellow bag, and then you perform your hand hygiene. You dispose all your contaminated waste to the yellow waste, medical waste bin. So if the child would vomit outside of the practice, it's just a vomit. But if anything happens in the medical practice, it's contaminated waste and you need to dispose it into the properly. What do you complete after the management of the spill? Incident form. On my picture, I took example from the ACPAL, one of the accreditation companies, but there can be any other incident form which you're using in your practice. So fill it up. And why is it important? Because if you clean the vomit and next day you wake up with the gastro, it may be related. So you just need to always remember to fill these things up. It's important. It's important for infectious control, for yourself, and for accreditation. And I would like everybody who watched this video today to go to the place where in your practice where you keep the spill kit and just touch it. Check if it's there. Check if everything we talked about is inside your spill kit. So find your spill kit today, and that will be the end of this training. Thank you very much. Nice to meet you. See you next time.